Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is Your Doctor Thinking? Part 1. If you have a blood test done and the blood sugar value is 90 and the laboratory says it's in the normal range and your doctor reassures you that everything is okay, you should have no concerns whether you have pre-diabetes, diabetes, or the consequences of insulin toxicity, that doctor is not thinking. I'm sorry to put it this way, but as long as I keep seeing cases where the doctors have completely ignored and neglected to diagnose prediabetes and diabetes for years because they simply accepted the dogma of the American Diabetic Association that if the blood sugar fasting value is less than 100, there is no reason to think about the existence of pre-diabetes, diabetes, or complications of diabetes. I have seen several cases, I've given you many case studies, where a person had severe neuropathy, numbness, tingling, pain, burning in both feet, sometimes even balance difficulties. Peak insulin in one case amazingly was 711, blood sugar was normal in the fasting rate. 3 neurologists in New York City never thought about the possibility of insulin toxicity. Here is a case study. Fasting glucose 90, which would be considered perfectly normal. 1 hour value of 213, clearly pre-diabetic, by some standards diabetic. 2 hour value 174. When you put together the 1 and 2 hours values, this, according to the American Diabetic Association, is flat out diabetes. It was completely missed by the doctor because he made the huge mistake of looking at the fasting blood sugar of 90 and reassuring the patient that everything is okay. The doctor was not thinking. I'm sorry, I recognize it's not very gracious on my part to say that the doctor was not thinking, but the doctor was not thinking, and you shouldn't have to pay the price because your doctor doesn't think for himself or herself. The insulin value in this case were fasting 11, 1 hour 77, 2 hours 95, 3 hours 17. Peak insulin value in many healthy people is less than 25. So this person's peak insulin value was 4 times as much. Excess insulin is inflaming, it is diabetizing, it is fattening, it damages the cells lining the arteries, so it sets the stage up for heart attacks, strokes, memory problems, kidney failure, dialysis, Alzheimer's disease. Do you still think that I'm being very unkind when I say that your doctor who looked at the blood sugar value of 90 fasting was not thinking when he did not think of the problems of insulin toxicity? Am I being ungenerous? You decide. The consequences are very serious. You wait for 5 or 10 years and you may have irreversible diabetes or irreversible kidney failure. Our vision at Children's Health Core is to provide authentic information for children all over the world. Obesity is rampant in the United States and many other parts of the world in children. 40% of children in New York City are overweight or obese. So this issue of undetected insulin toxicity and prediabetes is crucial. Children's Health Core Foundation was funded by Talat, my wife, and I some years ago with a vision of providing free of cost, free of corporate deceptions, information to children, their parents, teachers, grandchildren, parents, or anybody who is interested in the welfare of children. Please forward this YouTube segment to your friends, email, Facebook, Twitter, LinkedIn contacts. Please visit our website www.kids123.org. There is so much information. We also tell you how you can participate in our vision to be kind to the children of all regions of the world. Thank you. Thank you so much for joining us.